and we're coming from different parts of the world. I am this evening in Dubai, in the United Arab Emirates. Rajiv is in Leicester, of course, our home, and Dr. Tara Baradia is in Manchester. So Silver Star has become truly global with so many different ports for this particular program. We are just going to remind you that every single week you can be tested for diabetes at the Silver Star Centre in Leicester on a Wednesday. And Rajiv is on the road with the mobile diabetes unit, and you can also be tested at the Belgrave Neighbourhood Centre. Don't forget the stepladder. If you have not joined, then you need to join. We've had a number of winners. You win £10 if you get to the top of the stepladder. I so far have managed to get the highest position has been number 3. So I'm busily walking to try and increase my level of participation. Today's very special guest is Dr. Tara Baradia, who some of you will remember has actually been on Chai Chat before, but many sessions ago. She's going to talk to us about diabetes and dentistry, a subject that we don't normally cover in our Chai Chat. So it's great to have a dentist on. It's usually the doctors and the pharmacists who get on. She's an accomplished dentist who graduated with honours from the University of Manchester in 2021. Since then, she's worked across Greater Manchester as an NHS general dentist, gaining valuable experience in areas including sedation, head and neck surgery, and advanced dental care. She is fully qualified in both inhalation and intravenous sedation, with a particular interest in sedation and dental education. Throughout her career, Dr. Badaria has received multiple awards in recognition of her dedication and achievements. These include honours from the University of Manchester, Manchester City Council, the Royal College of Surgeons, and Physicians Glasgow, alongside accolades such as the Undergraduate Dental Student Award and the Distinguished Achievement Medal. Alongside her clinical work, she holds memberships of the Faculty of Dental Surgery and is a Fellow of the Higher Education Academy. With so many honours and so much to do, it is amazing that we actually managed to get her on the programme. But she is on, so a very warm welcome to you, Dr. Tara Baradia. The floor is yours for round about 15 minutes, and then we've got a series of questions. Just to remind you, you are being live streamed on YouTube.
Perfect. Thank you very much. That's the very nice introduction. So my name is Dr. Tara Baradia, but you can just call me as Tara. And today I'm going to be just talking through how diabetes can affect oral care. So I've already been introduced, but I currently work in Greater Manchester across the region, providing NHS and private services as a sedationist. I've got a big background in all the dental specialties. I've done a lot of extra training, and I also volunteer as a family court magistrate as well. So how does diabetes affect your mouth? So not many people know this, not many doctors will advise you on this, but there is a very strong and known link between gum disease in particular, which we'll cover a bit more later, and diabetes. It's what we call a bilateral relationship, which means that one can affect the other. So just having gum disease can mean you're higher risk of diabetes, and being diabetic can put you at higher risk of gum disease. Because of diabetes, you've also got increased sugar in your blood and everything, as you're aware. It also means you have increased sugar in your saliva. So you're more at risk of things like tooth decay because you've got a background higher rate of sugar in your mouth. And you've also got an increased risk of infections because of this. Diabetes can affect your ability to heal. And so a small infection to somebody else might become a bigger infection in someone who's diabetic. So we'll talk about gum disease first. So the biggest thing here is that there's a nice picture here of the 4 different stages. We've got gingivitis, which is irritation of the gum, and then actual gum disease, which is where the bone then starts to disappear around the teeth, leading to wobbly teeth. So gum inflammation, the teeth themselves then are not being held in as well by the bone, and they become wobbly and get lost over time. You'll either lose them by yourself, or you might be in pain and ask your dentist to remove them for you. What the biggest link that we see is the worse control you have over your diabetes, the worse your gum disease gets. And that again works both ways. So you might be in brilliant control of your diabetes, but if you're not looking after your teeth and you're not cleaning them properly, then you might be finding that it doesn't appear to be as well looked after. The treatments for this, apart from having really wobbly teeth removed, are having cleanings done either by your dentist, your hygienist, or your dental therapist, making them aware that you've got gum disease, and they'll be able to go through all the tools and everything that you need to know in order to look after your teeth, which is something we'll also talk about later. As I said earlier, the other condition that you might have is because of the increased sugar in your saliva in your mouth constantly, you're higher risk of getting tooth decay. So bacteria that live in your mouth normally will feed on this sugar and create acid, which is what causes the decay or holes that form in your teeth. It's just an acid wearing away the mineral of your teeth. Now, if these are caught early, they can either be reversed if they're very, very early, like the picture number 2 there, decay just in the enamel. You can reverse this with really good toothbrushing. You can stop the decay getting any worse. But as soon as it gets to that third picture where the decay gets into the middle part of the tooth, the yellow part, the dentine, then you're going to need at least a filling. And if it goes any further towards the nerve, you might need a root canal or even tooth removal. And like I said, because of your diabetes, you are higher risk of it progressing a lot quicker than it would in a normal healthy mouth, because you're already got that bigger sugar content in your mouth and as a background. And infection. So because your immune system is working a little bit harder, it's going to have more difficult time trying to figure out which infections to fight first. And you can be in more at risk of developing things, not just tooth or gum infections, like we've already discussed, but one big one is oral thrush, which is a white scrape. You can scrape it off in your mouth, but it kind of appears on your tongue. Or dry mouth as well, because many medications that you're on, every medication, if you imagine, has a small side effect of giving you a dry mouth. The more medications you're on, the drier your mouth is going to be. And if your mouth is dry, you're not getting enough saliva everywhere to wash away bits of food and everything, you're again at higher risk of decay. And it can also be due to the types of medications that you're taking, but it could also just be your lifestyle habits if you're not being as hydrated as you should be. The treatments here are good hygiene at home as well as at your dentist. The use of antifungal treatments if you needed to for thrush, or antibiotics if you've got tooth or gum infections, and substitutes for dry mouth, which we'll come to a bit later as well. So the key prevention of issues for yourselves would be ensuring that you have very good diabetic control. Like I said, your control can really affect your mouth. And a lot of people forget that if you imagine the mouth is the beginning of the journey, that's where everything's got to go in. And your mouth sees quite a lot of stuff. So better control you have up there, the easier it's going to be to keep your mouth in check. You need to have a really good, excellent oral hygiene routine, and that means at home. You can rely on your dentists and your therapists and hygienists to clean your teeth and provide you with the care you need, but 99% of the time it's mainly you at home with your toothbrush. So we're going to go through that all in a bit later. Making sure you're having regular dental checkups to make sure that there are no other infections or any other conditions happening, and also with your doctors as well, because they can help signpost you to other places for help. And if you've got things in your mouth like crowns or bridges, or dentures that come out at night, then we need to make sure they're really clean, because otherwise we're introducing a whole load of new bacteria into our mouth. So what are the pillars of good oral health? Now, everyone probably knows that you need to brush your teeth twice a day, but there's a lot more information in there that I want to go through with you, just to make sure we all have the same information there. So brushing twice a day with a fluoridated toothpaste. Fluoride in the topical use of it like this, where it's just being rubbed on your teeth, all it's going to do is provide you with a good strong layer of tooth. Your enamel will get stronger through the use of fluoride. And brushing twice a day, we say for at least 2 minutes. Now, often I'll ask my patients, well, how do you know it's for 2 minutes? And they say, I just know it is. If you're not using a timer, or your toothbrush hasn't got a timer on it, then you're not brushing for 2 minutes. You're probably brushing for a lot less. They did a study recently, and the average amount of time is 15 seconds, sorry, for brushing in the UK. So please, please use a timer, invest in a timer. It will really make a difference. Making sure you're spending at least 30 seconds in each quarter of your mouth. So bottom right, left, bottom right, top left, top right. Ideally using electric toothbrush if you can, but manual is just as good. If you're going to use a manual one, though, it needs to be not too hard. A lot of people see the hard bristled toothbrush and think that's going to clean my teeth a lot quicker. That's not the case. A medium or soft will do just as good a job. The only issue is with a hard toothbrush, you're going to brush away your gums. You're going to hurt them because they're very, very gentle. You're going to end up brushing them away. An electric toothbrush is great because it will do the same job everywhere in your mouth. There's no risk of you getting a bit tired and the brushing not being as good because the electric toothbrush is going to do all the work for you. You need to brush your teeth before bed. That means that's the last thing you're doing at night. You're not eating after you've brushed your teeth before you go to bed. You're going to bed with a nice clean mouth. And we at least say one other time. Now, that can be before breakfast, after breakfast. I personally brush before breakfast. If you're going to eat something, you need to wait at least 20 minutes before you brush because you're going to just, again, brush away the top layer of your tooth because all the acid in your mouth will be a lot more vulnerable at that time. Now, the biggest thing is after you brush your teeth, don't rinse your mouth out with water. Sounds a bit strange, but just spit out the toothpaste and get on with your day. The more you do it, you will get used to it. Rinsing with water afterwards is basically just washing away all the good stuff that the toothpaste has been trying to do. And that's the same with mouthwash. Don't use mouthwash straight after brushing. Use it after you've had your lunch or after you've come home from work, because otherwise you're going to take away all the good stuff of toothpaste and leave yourself with less protection. When it comes to brushing technique, you want to brush towards the gum line at a 45-degree angle. So I've got a picture here. So you need to really pay attention to make sure you're lifting your toothbrush up ever so slightly, because in that middle picture, you can see there's this line between the tooth and the gum, and that's where all the bad stuff likes to hide. So you need to get your toothbrush in there to make sure it's cleaning all of those surfaces out. That's why I say an electric is slightly better because it will just take out some of that complication for you. So I've already touched on mouthwash. You might be given Corsadil mouthwash or chlorhexidine mouthwash, which is specifically for patients with gum disease. The biggest thing here is to not use it for more than 2 weeks at a time because it will cause staining on your teeth unless you're using a version which is sometimes blue, which doesn't stain your teeth. But again, you don't want to be using it straight after you're brushing. You want to be using it at different times to make sure you're getting all the good stuff on your teeth when you're brushing and also when you're using your mouthwash. Some people use a fluoride mouthwash. These are your things like Listerine or Fluorogard, and those, again, you don't want to be using them straight after brushing. And you need to use them as an extra thing, but never to replace toothbrushing. Please don't think that just using mouthwash is going to do anything as near as good as brushing your teeth is, because when you're brushing your teeth, you're really agitating, pushing, scrubbing the bacteria off you. It's almost like washing your hands. It's not quite the same otherwise. Now, your dentist might advise you to use floss, or in this picture here, you can see what we call an interdental brush. Studies have shown that the brushes are a little bit better at actually moving stuff between your teeth because your toothbrush can't reach there, but you can use floss if that's your preference. I would always say, though, floss is a lot more difficult a technique to get used to. You end up with basically most of your hand in your mouth. And if you've not been shown properly how to use it, it can be very difficult. So these interdental brushes can be really good. I'd always say to do this before you brush your teeth because you're going to push out all the food that's stuck in there. And then when you're using your toothbrush, the hope is that parts of the toothpaste will get in between your teeth and help protect those areas. Some patients even carry them around with them when they've eaten, if they're out for dinner or something, just to get the bits of food out from between the teeth. These are a lot better for you than toothpicks because, again, they're going to be really gentle. The gum between your teeth, as you can see, these little pink triangles here are very sensitive. If you push it too hard, it will just go and never come back. See your dentist or hygienist, and they will be able to talk you through which sizes you need for which areas of your mouth. Behind your back teeth, you might need bigger ones, and the front teeth, you might need the smaller size here. The biggest thing here, though, is what you eat does affect your teeth massively. You need to be making sure you're drinking sugar-free drinks. Now that includes things like water. That would be my preference, if obviously if you can drink that between meals. But make sure you're not getting tricked by the no added sugar, things like juice and things like that. Sugar-free drinks are the best. Only have something with sugar when you're eating a meal. Avoid trying to put sugar in your tea or coffee. You ideally want sweeteners if you need them, or just drinking your tea and coffee plain if you can. A lot of medications have sugar in them. A lot of people don't realize that, especially if you're taking a medication a few times a day, that's going to be upsetting your mouth. Always ask your GP for alternative medications. A lot of the tablets have a sugar film on them. You can ask for a sugar-free alternative. They are exactly the same medication, just with a slightly different coating over them. They won't taste really any different, and it will make a big difference to your health. Make sure you're eating all your sugars at the same time as your meal. So in between all my meals, or I always recommend to my patients just have water or milk. And then when you're eating, you're going to eat everything all at once if you can. Now, with your diabetic control, that might be slightly different how it's going to work for you. That might be 4 or 5 small meals a day, but we'd ideally say around 4 is your maximum amount of times that you want to be putting your teeth at risk of sugar like that. Try to avoid snacking. If you need to have a snack or save snacks, things like cheese or fruit are always best because they're high protein, they're not going to damage your teeth, or fruit in that case is nice and fresh and healthy. It's not got, even though it's got sugar in it, it's not got fermented sugars like dried fruit might have. Every time you eat, just imagine that you're putting on 100% sugar on your teeth, whether you're having a bite of chocolate or a whole piece of chocolate cake. It's 100% sugar either way. Your teeth either have sugar on them or they don't. It's no in between. So the less times a day you can do this, the better. The government would advise you to do this 3 to 4 times a day at most, which is their government guidelines. Now, the specific dental care for diabetics will be to eat as normal before your appointments. Don't starve yourselves, or anything like that. Try to get mid-morning appointments because that's when your insulin and diabetic level of control will be better. You'll have eaten, but it won't be just fresh in your system. And shorter appointments are best if possible. Dental practices as well can manage if you have a hypoglycemic attack as standard. They all have the medical emergency kits in there. So even if you're out and about and you're not actually going to the dentist, you can always go there if you feel like you are having a hypoglycemic attack or you feel like you need any medical attention. A dental practice is a great, good place to stop off, get some advice. And soon we are hoping many dental practices will start doing blood pressure checks and blood sugar checks, which is something that the government will be rolling out. If you find that your mouth gets dry, please do ask your dentist about aids for this. So you can get on prescription, you can get dry mouth substitutes, so saliva sprays, saliva gels, or sugar-free pastilles that will help stimulate your saliva. And if you find that you like them, you can ask your GP to pop them on a repeat prescription for you. Also, ask your dentist for high fluoride toothpaste prescriptions. If you find that your dentist is telling you that you're at higher risk of tooth decay and gum disease, then high fluoride toothpaste is available for you only on prescription. And like I said, this is even stronger than the stuff you can buy at the supermarket, and it's going to keep your teeth. It's going to help with a bit of sensitivity, but mostly cavity control. And try to avoid habits like smoking or chewing anything like pan or betel nut, because that's just again going to introduce more bacteria into your mouth, and you're already at high risk of these things. If you've got dentures, so the plastic teeth that come out, make sure you're taking them out at night because otherwise they're going to get more susceptible to bacteria. Make sure you're keeping them clean. If you've got bridges, so false teeth that are crowned over each other, make sure you're using those small brushes I showed you earlier to clean underneath them, because there will be food and things getting stuck in there, and you'll often find you get an infection, and if the bridge has to come out, there's often not much else that they can do to help you apart from giving you a denture. So make sure you're looking after what you've got. Try to see your dentist very regularly, ideally every 6 months, because you are at higher risk of all of these conditions. Thank you very much for listening to me this evening, and I'm happy to take any questions.
There we are. Thank you very much, Dr. Tara. Got a couple of questions here about types of toothbrushes. You mentioned an electric one was preferable. The problem I've always had with electric toothbrushes is making sure they're charged. And usually you forget to put them on charge, so you don't use them effectively. But I've now started to turn to wooden toothbrushes, which you can get in Boots and other shops of that kind.
Yeah.
First of all, what do you think of having a wooden toothbrush? Does it do the same as having the fiberglass ones, which people currently use? I find them very hard on my gums. Secondly, the whole issue of flossing, which one can get addicted to, those little things you put in between your teeth. It starts like a very good idea, and then it becomes a habit to walk around with them. Is there a best time to do flossing? And a final question is, a lot of people have suggested, professionals, that we should brush our tongues because they say that there is certain activity, bacteria on our tongues, which will help, increase the level of diabetes. What's your view on those three very quick points before we take others?
So with the wooden toothbrushes, they're absolutely fine. They are just made of bamboo, which means that they're completely recyclable because unfortunately dentistry is not a very green industry. If you imagine every toothbrush, every plastic toothbrush that you or your children have ever used is still around on the planet today. So a wooden toothbrushes, there's nothing wrong with it. And there are some electric toothbrush brands that make their products from recycled plastic. So there's nothing wrong with it. It's just about your technique. When you're looking at buying a toothbrush, it will often say medium, soft, or hard at the top. If you're using one and you think it's too hard on your gums, then go to the one below. I mean, I would never recommend the hard because it's always too hard and does damage your gums, but medium or soft is good. Or even a children's toothbrush sometimes as well can be really useful. When it comes to the matter of charging, I find just keeping my charger right next to my toothbrush in the bathroom because they're normally plugged into a shaver socket. Just keeping it near there all the time and then just popping it on there most days is good. Or you can get Oral-B now do one with a USB charger, so you can just have it plugged in next to your phone when you go to bed. When it comes to flossing, the TP brushes are brilliant. You don't want to be overusing them. I'd say two to three times a day. Make sure that they fit snug. So if they fit too easily, they won't be pushing anything out. If they hurt to push through, then they're too big. You need the size in between. But there's nothing wrong with those as long as you're using them correctly. A lot of people think with the brushes you need to slide them between your teeth. You don't. You just need to poke between the gap at the bottom of your tooth. You're not trying to get through it like floss. I mean, I think either one is fine. If you can get used to floss, great. But if you're finding it difficult, then there's nothing wrong with using the TP brushes. I actually prefer using them just because they actually really push stuff out and you can see it between your teeth coming out. And with your final question, you might have to remind me.
Brushing your tongue.
Oh, brushing the tongue. Yes, brushing the tongue is good, definitely. I always just run over my tongue with my electric toothbrush for a few seconds after brushing. There's nothing, as long as you're eating a varied diet. It's normally that nowadays people eat a very soft diet, so it's not abrasive, it's not pressing anything off your tongue. But brushing your tongue is great. I definitely would recommend it. You don't need a fancy tool for it, though. You don't need a fancy scraper. You might like it, and that's fine if that works for you. But don't look at, if you're going to use a scraper, don't look at it and think, oh, that's all the gross stuff that's come off, because it won't be. It will just be mostly dead skin cells. So don't think that you need to keep going. Just running over your tongue for a couple seconds every time you brush your teeth is more than enough with a toothbrush. But make sure you're not going too far back with it either and hurting yourself.
Excellent. Thank you, Tara. Let's go to Chandrika, who's got her hand up. Chandrika, if you unmute and then ask your question.
Hello, this is Chandrika here. I just have a quick question. There is too many toothpaste is out there, and what is the right one to buy? One is white, one is different color, one is so and so. Too many.
Yeah, I completely agree. It's a very, very crowded market. The easy answer is get the cheapest one that has at least 1,450 parts per million of fluoride. So Colgate will normally have one of their brands on offer for £1. That's the one you need. If you get sensitive teeth, if you find that your teeth get very sensitive to cold, then you might want to use something like a Sensodyne. But again, you don't need to use the really expensive ones, just the one that's the cheapest that will do the job. if you get your toothpaste on prescription, most people in here would qualify for that. You do need to talk to your dentist. Some GPs aren't happy to prescribe it. Then you might be able to get your toothpaste for free as well if you can do it through
Are you
that.
talking about this fluoride one?
Yes, the
On the
Durafat
prescription.
one. Yeah.
It's very thin, isn't it? And different.
Yeah, some people like it, some people don't like it, but you would all qualify to get it. So I'd suggest getting one, trying it. If you like it, you like it. If you find a brand you don't like, then you don't have to be using it. But really, the cheapest one that's going to do the job. There's no need for these like £12 toothpastes anymore.
No, because a couple of times I went and bought it and it comes out blue color. Some of them comes out white color. I said, Sensodyne.
Yeah.
What is all this, you know?
Yeah,
And
they're just trying to
very,
make
very
themselves different,
sensitive.
and there's also none of them are going to whiten your teeth, unfortunately. So with whitening, it's all about you need bleach to whiten your teeth. And the trick is that they'll often use a toothpaste that's like black, like a charcoal toothpaste. And it's just the contrast between your toothbrush and your toothpaste and the black that makes you think that your teeth are getting whiter, but really they're often not. So if you want your teeth whiter, then you're going to need to use whitening toothpaste.
Okay, thank you.
Okay, are there any more questions? Somebody commented, what was I eating when you were speaking? Actually, it's cashew nuts. And that's one of the questions I wanted to ask you. You're obviously a great fan of water, as I am. Although people suggest we shouldn't drink water while we're eating our dinner because it loosens the digestive juices. But what about snacking on things like nuts? What's the best thing to snack on without causing problems to your teeth? Obviously, chocolates are out for diabetics. But what should we snack on?
So cheese is always a safe snack. Nuts are good, but just be wary if you have any wobbly teeth or anything like that, then they are going to be higher risk because nuts are quite hard. Um, and fresh fruit really is best otherwise, whether it's, just seasonal stuff like mango or just berries, all of that is very good. But you don't want anything that's got anything hidden in it, nothing too sweet. So anything with added sugar, any dried fruit, like dried apricots can be some of the worst, just because they've got extra sugar on them almost.
Now, another really big problem before we see if anyone else wants to come in is people just don't make the same effort to go and see their dentist as they do to see their GP. And this is a real problem. You do from time to time, I get from my dental surgery, a reminder, we haven't seen you for a year. You haven't seen your dental nurse. Why don't you come in and have a checkup? That's being very proactive. But most people don't do that, do they? They don't say, by the way, I haven't seen my dentist, unless they've got a toothache, in which case they're ringing you on a Sunday saying, I need to see you Monday morning.
Yes.
How do we diarize this? Should we go once a year?
I'd say at a minimum once a year, ideally every 6 months. But if you have gum disease, then your dentist is going to want to see you every 3 months, just to keep an eye on everything a bit quicker. I appreciate with a lot of NHS, well, finding an NHS dentist can be difficult, and then the expense with seeing a dentist regularly is also there. But I can only recommend that if you see someone regularly, you're not going to get the problems that you then need to fork out much more money for if it's crowns, bridges, if it's root canal treatments. If you see someone regularly, if you keep it in your own personal diary, just take ownership of it. Your dentist is never going to be unhappy if you're calling up saying, I'm due for my 6 month checkup. So put it in your own diaries. Think of it as January, I'm going to see the dentist, and July, I'm going to see the dentist. And then that's a really good way of keeping on top of it. And with diabetics, obviously, you have plenty of appointments. And unfortunately, this is just one other one to have. But I can't recommend it enough, just the importance of being seen. Because we can catch things a lot earlier and treat them before they become issues that way.
I think we are done with questions. People are not putting their little yellow hands up. So if there are any further questions, can we send them to you by email, Dr. Bangaria, and maybe you can give us a reply. And as you would say to your patients, don't leave it so long next time. I think it's been 2 years since you've come in, but we'll have you in regularly to have a look at our teeth, because it is a very, very important way. Thank you so much for coming. We know you're really busy, and I really appreciate you giving us your excellent presentation and
No
answering all
worries
the
at all.
questions.
I'll see you all again in 6 months, and that will remind you to book your next checkup.
Indeed. Let's go to the news headlines. The news headlines are coming from Leicester and they're being read by our director, Rajiv. News headlines
Okay.
for diabetics.
News headlines of the week. NHS and Diabetes UK warn your breakfast could increase heart attack and stroke disease. The NHS has issued message to people who eat breakfast, as some people could unknowingly be putting themselves at risk of heart attack, stroke, and even diabetes. It adds that sugar and fat are the biggest things to watch out for the breakfast time. So if you have any of the following in the morning: chocolate cereal, frosted flakes, honey crunch cereal, croissants, cereal bars, you might want to try and swap it out for wheat biscuit cereal, shredded whole grain cereal, no added sugar muesli, porridge, wholemeal toast, plain natural yogurt topped with chopped fruit. Next one. List of healthy foods you should avoid if you have diabetes, including grapes. The British Dietitian Association explains each time you have a sugary or starchy food or a drink, the blood glucose level in your body rises. Some of these foods are quickly digested and cause quick and sharp rises in your blood glucose levels. They are called high GI foods and drinks. The foods which could be significantly raising your blood sugars include grapes, ramen, potatoes, sushi, dried fruits, fruit juice, and cereal. Next slide. More daily steps can lower health risk even for people who sit a lot. A large study found that highly daily step count were linked to lower diseases of death and cardiovascular disease, even in people who were highly sedentary. The biggest benefit was seen around 9,000 to 10,000
I think that Rajiv has frozen. He's become frozen. Is it very cold in Leicester at the moment? Because we seem to have lost Rajiv in the middle of telling us to do more steps. Are you there, Rajiv, or have you become frozen in time? I think he probably has been frozen in time. In the meantime, let's take Rajiv's message, which is that we should do as many steps as possible, and remind you there are now 14 people on the step ladder. So far, we've given away £50 worth of prizes. Every person who's at the top of the steps ladder will get £10. I haven't managed to get there in time, but we're going to try and work a bit harder. Since we've lost the link to Leicester, but we are still here from Dubai. Can I thank all of you for joining us for the weekly Diabetes Chai Chat? Thank Dr. Tara Bandaria. Oh, he's back again. Thank Rajiv for his presentation and giving us the news headlines. And we will see you all again very shortly. If not for your test at the 201 Uppingham Road, then certainly we will see you at the Belgrave Neighbourhood Centre. So thank you for joining us, and we'll see